We're live.
Okay. Hi, Sharon. My name is Carolyn.
Hi,
Thank
nice
you
to
for
meet you.
coming in today. So I understand that you were here because your neurologist sent you
Yes, I've been having consistent migraines.
migraines. Okay. And did he tell you what type of migraines he suspected they were? Or did he do any tests?
I was told they're basilar migraines, but they seem to be aggravated when my neck's hurting.
Okay. And how many times a week are you having these migraines?
Probably about twice a week,
How long have you been having them for?
about 3 years.
Okay. And when you have one of these migraines, how many hours a day does it affect you for?
Anywhere from 6 hours to 3 days.
Okay. And how many of these migraines, what percentage of them would you say are a result of the neck pain?
Probably about 50%.
Okay. What I'd like to do is, while we're talking about the migraines, to get a little bit more information from you about your past medical history and medications, and a few things about your current living situation. That'll help me make some decisions about my exam process and how I'm going to treat you. Is that okay?
Yep.
Great. Well, first of all, I'd like to know, I want to verify I have you as 31 years old, female. You're referred here by your neurologist for migraines. And tell me a little bit about your past history. Have you had children? Do you have any history of other diseases that I should know about?
I have two children,
How old are they?
6 and 3, both girls.
Okay. And you currently live with family members, including your children?
Yeah, my husband and both girls.
Okay. So, besides having the kids, have you been hospitalized for anything else?
I've had allergic reactions.
What were those allergic reactions to?
One was to clindamycin, and one was to shellfish.
Okay. And those are the only other hospitalizations you've had? No other surgeries or back surgery, neck surgery,
Mm,
organs removed?
no.
Okay. What about any history of back or neck injury?
Um, I had a back injury in high school,
Okay.
upper
Which
back,
was,
shoulders, and that was from carrying heavy equipment.
okay. And did that start your migraines? Or
Um,
that you say they started 3 years ago, but did you have any headaches immediately after that injury?
no.
Okay. Do you have any history of diabetes, heart disease, or kidney or liver function problems?
Family history, but I don't have any.
Okay. What about any history of cancer for yourself?
Nope.
Okay. Are you taking any current medications on a regular basis?
No,
What about any vitamins or minerals that you take every day?
not usually.
Okay. Do you take anything for your migraine pain?
Um, Occasionally, I'll take an Aleve, but if I start feeling them come on, they've been trying me on a couple different medications, and nothing really has worked so far. And they stopped the Imitrex that I was on because once they figured out that it was basilar migraines, it's contraindicative.
Mm-hmm. Okay, but they don't have any prophylactic meds for you right now.
The one kind they can take, I can't take because of another condition, because of an allergic reaction condition I have,
What is that called?
erythema multiforme.
Okay. And when was the last time you experienced symptoms of that?
Um, 2008.
Okay. If you think of anything in your past medical history, even if you don't think it's relevant or important, make sure you bring it up to me because there could be things that we use in the clinic, lotions or
Mm-hmm.
gels, or things that I know affect certain things in your musculoskeletal system. Okay,
Mm-hmm.
and it helps me rule out what's going on. Have you had any medical tests like an EKG or a CAT scan or MRI for your migraines?
They've done, yeah, they tested to make sure it wasn't seizures
Mm-hmm.
originally, so they did the EKG, they did the electrodes, I don't remember what it's called,
Mm-hmm.
with the strobe test.
Okay.
They did the MRI.
And were there any results from those tests that you remember?
Um, that's how they diagnosed the type of migraine it was,
Okay.
but it's I guess it's similar results to a seizure with the lights, but
Okay.
it's not seizure activity.
Okay. So no seizure activity, and you haven't had any seizures in the past.
Mm-mm.
Okay. Do you currently work?
Yes, I'm a speech pathologist.
Okay. And do you work a regular full-time or part-time?
Part-time in nursing homes.
Okay. And in your home, do you have any difficulties going in and out of the home? Do you have stairs inside?
I have about 13 stairs that go up to the second floor and about 13 stairs that goes down to the basement,
Okay, so 2 flights.
and then about 7 stairs in 2 sections, 3 and 4, to go into the house from outside.
Okay. How do you have any problems going up and down those stairs, especially when you have a migraine? Or
If I have the migraines, my balance is off, so
okay,
I try to go upstairs, or my husband will assist me upstairs, and then I stay.
okay. So the migraines seem to affect your balance while walking.
Yes,
Okay. When you lay down with a migraine, do you get dizzy?
yes.
Okay. Do you experience any vomiting or visual disturbances with the migraines?
I get sometimes vomiting. That's just on rare occasion. But I usually have visual disturbances prior to the migraine because the type I have.
Mm-hmm.
But once those stop, that's when the migraine starts. So it's kind of an indicator that I know the migraine's coming. I
Okay.
get an aura.
Okay. That's pretty common with migraines. Have in the past 3 years since you started having the migraines, has it changed anything that you're capable of doing, whether it's driving or cooking for your family, cleaning your home, dressing yourself, personal hygiene, work,
If
or
it's
anything like that?
currently a migraine is going on, then yes, all of the above during it.
Okay.
But when I don't have a migraine, it's changed where I can't drive at night now because of the oncoming lights from traffic is kind of like a strobe. And at certain times of day, if I'm on highway, the way the light comes through trees makes it kind of like a strobe, and that sets them off.
Okay, so it affects your driving,
Mm-hmm.
your ability to drive.
Yep.
Now, what about the neck pain that sometimes causes or contributes to the migraines? Does that affect the way you're able to do anything like take care of yourself or children or home?
Yeah, if I can't pick up my kids if my neck's bothering me because that will just aggravate it more.
Okay. What side of your neck is that pain on?
Usually the right.
The right side? Does it radiate anywhere?
It radiates down through my shoulder blade and up through my head.
And is that all on the right side?
Yes.
Okay, so right shoulder blade, right shoulder and neck and head.
Mm-hmm.
Have you ever had any falls?
Yes. I fell on ice last year. Just slipped because it was icy out, and I fell
Okay.
on my right hip. But I had a cushioned coat, a big thick coat, so that kind of was a softer landing.
Did you end up going to the emergency room or to a doctor after that fall? Any
Mm-mm.
history of concussion after that?
No, not with that one. About 6 years ago, I fell off a bike. I had a helmet on, and I did go to the emergency room for that. I had a concussion. I broke the helmet.
Well, go big or go home. So, but after the concussion, you were able to return to normal function, do everything you'd done previously before
Yeah,
the
after
bike
a few
fall?
weeks.
After a few weeks. And that was still 3 years before your migraine started.
Yep.
Okay. So, got that. Now, your neurologist sent you to me because the neck pain is contributing to your migraines, and this is belief that we can help you. What are some things you'd like to see come out of physical therapy?
Reduced.
What do you want me to be able to do for you?
I'd like to be able to have reduced neck pain, but also more range of motion because when I get the neck pain, I don't move as well. My balance
Okay.
is off. So be able to control all of that more, especially because I have 2 little kids and my husband works a lot.
Okay.
So be able to just take care of my family more.
Okay, so we can look at how we can increase the function of your neck, make sure that you can move it fully in the way any other human being would be able to without restriction, and look at the muscle balance and the tissues in that area to make sure that anything I can do to help relieve any pain or tightness or weaknesses that may be causing these some contributing to the migraines. I can't promise that we can get rid of the migraines, but I can say that we'll do the best we can with the neck pain to at least eliminate or reduce its contribution to your other problems.
Okay.
Okay. Do you have any questions for me?
Not really at this time.
Okay. So what we'll do next is proceed to the examination. Before we start the examination, I'd like to ask, do you have any current neck pain or headache right now?
I have a little bit of pain at the base of my head, top of my neck on the right.
Okay. And at the base and the top of your head, where that pain goes through on your right, would you give that a 0, as in not at all, or a 10, like I'm going to the emergency room right now?
Probably about a 2 right now.
A 2?
So I can kind of, when I have that, I can feel it in my, like behind my right eye and everything, even though I don't have a migraine right now.
So it's just kind of there.
Yeah.
Do you ever reach a 0?
Yeah. Yeah, sometimes. I mean, it's always kind of nagging.
So it's always between a 1 and a 2, would you say?
Yeah.
And then at its very worst, what is it usually?
A 10.
A 10?
More, yeah.
Okay. 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 Well, let's go ahead and get started with a physical exam if you're okay with that.
Sounds good.
All right.
Thank you.
Thank you.